Hey everybody, Dr. Tam and Ann here again from Absolute Integrative Physical Medicine. And today we have a really good topic talking about one of the procedures that we do called trigger point therapy. Patients and people have asked about what is trigger point therapy, and how it works. Lots of different questions that we have in here, a lot of value. We're looking to add value. For those of you who have not subscribed yet, make sure you do subscribe, and then we'll talk all about trigger points. So, Anne, what's the first question that you have for me regarding trigger points?
Thank you, Dr. Tam. So we get this question a lot actually on our Facebook page from our patients. So they ask, what is it and how does it work?
Sure. Trigger point therapy, what it is an injection. It's an injection into the muscles, the tendons to break down scar tissue. See, what happens is as we get injured, the muscles in our body can bind up. Think of like dough, right? Just binding together. Or like noodles, for example. Muscles are like strands of noodles that are really bind together. But what happens is over time, it gets inflamed. And when it gets inflamed, it can really turn into like a ball of wax and just get stuck. And that's where your body can start experiencing pain. You start having lack of movement, right? And that's where trigger point therapy really, really shines.
Oh, wow. I'm a bit curious. And what is the cause of a trigger point?
Well, the cause of it is usually an injury of some sort. Prolonged inflammation, an injury. It could be something that was struck. Like say, for example, if you are a basketball player or a football player, right? And you got hit really hard in one area. Well, the body tries to protect itself. And what it does is that muscle is going to lock up. The muscle will start spasming, right? That's one way, through an injury. It could be the fact that you have overused an area so much where the body tries to lay down scar tissue to protect that area. And now that can over time cause another trigger point. A third one could be your spinal cord or somewhere in your nerves are injured or compressed. And then it's causing a muscle spasm. Well, initially it's called a muscle spasm, Candy. But overall, that muscle spasm can turn into a huge knot and become really, really inflamed.
Oh, wow. And it is actually believed that a variety of factors results in trigger points. Can you give us an example or some examples that you know?
Yeah. When you look at overused muscle, right, they could be stress as well. Stress is really the one thing in the body that can cause a lot of inflammation. Inflammation from the 1920 book of Guyton Physiology stated that inflammation is the cause of all diseases. Not some diseases, Candy, all of them, right? Now, our bodies can also be in terms of posture. When you start being too sedentary, and it happens to a lot of people here in the US, right? Not enough movement. Now the body locks up again. Well, could it be also that you're deficient in vitamins? Nowadays, even if we eat the best foods in the world, we can't consume enough food to get the right nutrients, right? Back in the 50s, compared to the nutrients now, one bowl of spinach, it's like 12 bowls today. One apple in the 50s is 5 apples today. So that can cause a lot of problems as well. Joint problems, chronic stress on that muscle. Something is stressing that muscle out, and that is one of the huge causes of trigger points.
Okay, now how do we treat trigger points, and how long does it take for the procedure to work, and is it painful?
Yeah, so that's a great question. First off, when a patient comes into our office, we have to figure out, number one, where the trigger points are. On top of asking you questions about your function, about your goals, one of the providers is going to find out where you have trigger points in the body. So that trigger point exam is going to be really, really important. Then afterwards is we go along with the treatment. Each trigger point treatment therapy takes about 15 to 30 minutes to do. And it can happen weekly, it can happen every other week until that trigger point is gone, right? Once the injection happens, it works pretty quickly because we're injecting something called serapin into the body. And serapin is completely natural. It's actually derived from the pitcher plant from South America. So it's all plant-based. There's zero side effects to it, right? Because you don't want to use steroids or cortisone in a muscle. See, steroids and cortisone causes your body to elevate diabetes, sugar levels, right? Increases cortisol into the body, stress. It also breaks down the muscles, tendons, and ligaments, and then starts causing problems with blood flow to the area as well. So steroids is something we do not use. That's why we choose to use serapin. Now, going back to your question, well, how long does it take? How long does it last, right? And then we'll cover, does it hurt? How long it takes is once the treatment's done, then that muscle is broken down and the muscle's healing over the next 1 to 3 weeks, right? So sometimes you have to get multiple treatments at the beginning, and then there could be some maintenance treatments. But once that muscle is broken down, the key is don't go back and repeat to do the same things that you have done to get here. For example, if it's from repetitive use, you need to do something about that so you're not repeatedly using and breaking down that area once again. And then ultimately, does it hurt? It feels like a pinch. If anyone has ever gotten pinched by, like, you ever gotten pinched by the tip of the nail, right? Candy, do you have siblings?
Yes.
Do you have siblings yourself?
I do.
You do? Any
and they
sisters?
always pinch me a lot.
Okay, so they always pinch you a lot. So it happens as adults, happens as kids.
Mm-hmm.
But when that pinch happens, someone taking a little piece of your skin just pinches it, that's what it feels like, So, but once the injection happens, it's actually really amazing. And then your whole body becomes a lot looser that way.
Oh, okay. That's very informative, Dr. Tam. And for the last question for today, what are trigger points, or why are trigger points so neglected by medicine?
Well, here's the thing, is that in medicine, in Western medicine, I should start with that. Most of the problems and pain and inflammation in the body is treated by medications, right? If you have pain somewhere, your doctor is going to prescribe you a pain medication. They might give you some exercises, and then they go and move on to cortisone shots, which further degrades and degenerates the body. And if that doesn't work, Candy, what do you think they do? They go into surgery, right? It's surgery after that. So it's pills, physical therapy, shots, and surgery. And that process could go on for years. Well, if that process can go on for years, the person's continuously getting worse over the next 5 to 10 years. By the time surgery is recommended, say if you do end up going with surgery, you're going to end up cutting that area, causing even more scar tissue, right? So to really fix the problem to begin with, it's figuring out the cause of the problem. Is it a misalignment of the spine? Is it a misuse or overuse of a body part that's causing that problem? I mean, somewhere, something, somehow is causing that. And we got to figure out what it is first. And once we figure it out, okay, now we got to go ahead and treat it.
So thank you, everyone. And then don't forget to subscribe. We will be talking about more interesting topics.
All right, Candy. Thank you so much. Have a great day.